I would estimate that 10 to 20% of our patients are extremely difficult to image with technical limitations in the study. And in those patients, the use of contrast can offer a tremendous impact in terms of the diagnostic information that we receive from doing an echo exam. Usually by looking through the patient's chart, you can get some clinical background that can help you decide whether a patient will be difficult to image. For example, if a patient has a history of COPD, or obviously if you look at a patient and we have a fair number of patients who are greater than 500 pounds. Those are technically difficult patients, obviously, and those patients, then contrast can have a great impact on the information that we receive from doing the study. In addition, I think in many cases we can get diagnostic information from the echo study with the use of contrast that we couldn't get if we didn't use it. I remember doing a patient in the emergency room myself who was brought to the emergency room because of chest pain, and I performed the echo portably there. It was a fairly difficult study. I couldn't see endocardial borders very well. I was looking for regional wall motion abnormalities. I could tell that there was some left ventricular hypertrophy, but again, I couldn't see the entire left ventricle very well. Did give a contrast agent, and we could clearly see that there was an apical cardiomyopathy, which made that diagnosis made a tremendous difference then in the management of the patient, obviously.